Okay, so in our third video on upper limb nerves, we're going to look at another nerve here. So this is a 23-year-old male weightlifter who presents to the emergency department one day after straining his upper arm while doing curls. He described a sudden forceful contraction of the arm when the weight slipped. He is complaining of weakness around the elbow. Again, pause the video, see if you can work out which nerve is affected and how much of the anatomy you can remember. This is an injury to the musculocutaneous nerve. It arises from the lateral cord of the brachial plexus and is supplied by nerve fibers from the C5 and C6 nerve roots. It is the nerve of the flexor compartment of the arm, supplying biceps brachii, brachialis and coracobrachialis. The nerve emerges as the smaller terminal branch of the lateral cord and then runs between biceps and brachialis. So it's deep to biceps but on the superficial surface of brachialis. From this position it supplies biceps brachii, the brachialis muscle and coracobrachialis. In the distal part of the arm, it emerges from the lateral border of these muscles to form the lateral cutaneous nerve of the forearm and supplies the lateral aspect of the forearm. So as we said, it supplies the biceps brachialis and coracobrachialis, and its sensory function is nerve supply to the lateral forearm. Injury to this nerve will cause weakness of elbow flexion and supination and numbness to the lateral forearm. And some of the injuries that can cause this would be compression injuries. So for example, in patients whose arms are outstretched for anesthetic purposes, or if they've slept badly on the arm, they may get a weakness in the elbow flexion due to musculocutaneous nerve dysfunction. And as with the patient we saw in this case, severe flexor muscle contraction can also cause damage to the nerve. As usual, if you have any questions, you can bring them up in class. We have two more nerves to look at, the median and ulnar nerve. We'll do these in subsequent lectures. Thank you for listening.